Hey, this is Matt. Welcome back to the channel, everybody, where I'm going to be sharing with you 5 things you should know before getting a beard transplantation. Before we start with the video, as always, this video has been brought to you by GoFiber, which are hair building fibers you can use to mask any thinning or patchy areas on your scalp to make your hair look thicker and better. So make sure you check out the link in the video description below where you can visit GoFiber, get a free sample of your choice from them and try them out, see if you like them. Hey, welcome back once again. My name is Matt and you are watching my hair loss and hair transplant related channel where I talk about these topics all year round. So if you're new, make sure you subscribe right now and like this video. Did you subscribe? Okay, so as many of you guys know, I myself got a beard transplant about 3 weeks ago. So make sure you check out the video which I made post-operation, how it all went and all that. Very good video. And this also triggered, I guess, more of my interest in this, beard hair restoration, because I don't think there are many guys talking about that and diving deeper, like what makes a beard transplant natural, what are some traps that can happen to guys if they choose a bad beard transplantation clinic or doctor. So with this video, I want to share with you 5 things that you should know, 5 things that can really help you out before deciding to get your beard transplant done the proper way. Starting with the thing number 1 that you should know before your beard transplant. Let's start with the beard line design. The most important part about the beard line design, I would say, is the beard line itself and the reconnection with the mustache, but also the area here underneath your lower lip, okay? There are some very artistic areas which need to be done correctly. The hairline, the beard line shouldn't be done very aggressively. And also only very soft single grafts should be used for the outline of the beard line and also for the outline of the mustache. And that's usually the case also with natural beard, because natural beards, they only contain 80% single hairs. The beard follicles in your natural beard, if you have a full beard, produce 80% of the time only single hair, and that should be implanted especially on the lines here around the mustache area. And to fill all that here, some doubles could be used, and obviously triples or even multiples like quadruples if you are somebody who is using donor area from the occipital region for the beard hair restoration. Because if you don't have any reserves here, which, some beard grafts as I had, which could be extracted and implanted here, then you have to rely on the donor area. So again, soft single hairs should be used prevalently in the beard, and especially on the lines, on the outlines. Okay, that's very important, because if the doctor uses doubles or triples, it can look very robust, it can look very aggressive, and I see many clinics doing this wrong, especially with the beard lines. Sometimes they put them very high, they make them very, very defined, and this is a pretty big mistake, because instead of starting the line very soft, so it's going to start thickening gradually here, you start with it very high, and if you start with a very high density on the beard line already, you cannot go lower density below. You just have to do the same or even higher density, and this will cause like grafts wasting. It will also increase the potential of over harvesting your donor area, because that will require many grafts. And this is dangerous, okay? So always be aware of that as a patient, and think about that carefully before you decide to do it. Number 2 thing that you should know before your beard transplant: surface calculation before estimating how many grafts you need or how many follicles you need for the beard transplant, okay? As you can see here in this video, my clinic calculated the areas which were like more patchy, and I wanted to have them filled out. They calculated exactly how many square centimeters are these, and then they multiplied that by implanted density, which was like estimated per square centimeter, and we came onto like the final graft number necessary. Now there are many clinics who don't do it, who skip this step. They will just tell the patient, you need 3,000, you need 4,000, and that's really bad, because I'm saying if the doctor is not even able to take 5 minutes, because really literally it takes 5 minutes to do this step, if he doesn't want to do 5 minutes of this to precisely calculate the surface and then multiply it with the density and come to like a precise number of graft number you need, then I doubt whether he wants to make that job the best for you as a patient, okay? I really doubt whether he has your best interest in mind as far as doing that beard transplant the best way possible. So be really aware of that as well. As far as the density itself, usually the best doctors who do beard transplants, they usually don't go with more than 30 grafts per square centimeter by somebody who has no beard, okay? On the area which is completely bare. So with me, they did 15, because here I had already 15 grafts or 15 follicles density per square centimeter. So they did another 15, came on to like 30, and on the areas where there were less density, they did like around 20. So, but usually if you have no beard, nothing here, usually 30 is a good density already, and you should not want to go even higher. I mean, you could maybe during the second procedure if you feel like you need more density, but usually 30 is all right already. Okay, so that's also a very important thing that you need to ask your doctor whether he is calculating the surface, and you know, also ask him about the density per square centimeter on the beard. Number 3, what type of hair is the most suitable for the beard transplantation? Of course, I've seen cases where patients are, obviously the most common ones is taking the hair from the occipital region, from the back, and transplanting it on the beard. Then you oftentimes see something like I did, where they take the beard hair from the neck and transplant it on your beard over here. Also chest hair is possible, probably also some hair from other body parts, I guess. I haven't seen it so frequently, but what oftentimes doctors will tell you that the most ideal hair for the beard transplantation, as far as suitability, is the hair from the neck area underneath the chin, also chest hair, in terms of, you know, same hair caliber, in terms of having the same structure, texture, kind of kinkiness. It's more similar to your natural beard hair compared to the hair from the back. It's different, you know, the hair from the occipital region is a bit different, and that's why the doctors usually suggest, you know, to take that hair first and then supplement it with some hair from the occipital region. But obviously if patients don't have any hair available, like here, like I did, then they need to go straight for the hair from the occipital region. And again, sometimes this hair will need to be refined, especially if you want to use it for the beard line, because from that area you get a lot of multiple grafts, and these need to be refined onto like doubles and singles, so the result can look natural, especially on the lines here, okay, if you want to restore that. Very important. So one way how to refine these grafts would be using the microscopes, if the clinic has microscopes for this dissecting these multiple grafts onto like single grafts. Obviously, because clinics don't have maybe enough personnel, they don't have stereo microscopes, they don't split so many of these multiples from the donor, and that's why some guys end up with very robust looking beards which are not that soft looking, not that natural, and that's because clinics don't have time, and again, they don't have these microscopes, they don't have equipment for proper dissection of these multiple grafts onto single grafts, and that results in sometimes unnatural results. But of course, if you get your beard hairs from this donor area, from here, usually here there are only singles, so they will be just placed, you know, they don't need to be refined anymore, and you will have a natural result as long as the clinic knows how to properly place them, use the correct angulation, and use a sufficient density for the transplantation. Number 4 thing you need to know: who is a best beard hair transplant candidate. Okay, ideally, as it is the case with a hair transplant, ideally somebody who doesn't need a lot of beard restoration, beard hair restoration. Maybe somebody like me, you know, who already had this this, and just needed a little bit more density here. Fill out this patch. So if you're somebody like that, chances are you may also have your beard here, and this can be utilized, and this hair can be removed and transplanted here. And since many of you guys are probably also shaving this area, or at least trimming it shorter, this hair can be easily used, and you will not be missing it in the future, and you will be happy to have it here on the front, where it can create that more, you know, fuller look, more well-balanced, well-blended look all over your jawline. So that would be the best candidate, somebody who needs maybe 1,000-2,000 beard follicles, who already has some base. That's why I always say to guys, as I stated at the beginning of the first video, guys, don't get a beard transplant, but first try minoxidil, you know, try dermarolling, try oral castor oil, 1 maximum 2 milliliter per day oral, in order to avoid the laxative effect of it. But all these things, they combined, they can help you grow your beard, and give it at least 6 months, 6 to 9 months, to see if you can grow something, and that will be your base. And on top of that, you can get a beard transplant later on. Another thing, as far as who is the right or not right candidate for the beard transplant, would be if you are a Caucasian guy, if you are a white guy, somebody with pale skin. That's very good, because then the potential scarring, if they extract the graft, especially from your neck, can be minimized. The hypopigmentation can be minimized, because these extraction, if they remove the graft from here, they will leave scars, and these will look whiter, okay? So if you have dark complexion, it can cause some hypopigmentation, okay? It may not happen always. The likelihood may be 5-10%, but it's possible. You know, the risk is a bit higher by guys with darker skin complexion. Obviously, if your beard transplant will be done by utilization of the scalp hair from the donor area here, then it's all right, because you can grow that hair longer on the donor, and these white dots will not be as visible, and we know it from hair restoration, so that's not a big of a deal. But here, usually the grafts are very sparse, it's not as dense here, so if they extract like 50% of them, some dots can be visible, you know, especially if you shave it. I'm going to be shaving it in the next video, so you will see it in my case. And obviously, last thing, as far as good beard hair transplant candidate, would be having a very rich donor area on the occipital region, but also here, also maybe a lot of chest hairs. All these combined can be utilized, and you can really end up with a full looking beard, and that's very good. So that would be like a third thing which could make somebody a really good, almost outstanding beard transplant candidate. Am I telling you that if you don't have this hair, if you don't have any chest hair, you only have hair in the occipital region which could be utilized for the beard transplant, am I saying you cannot get a beard transplant? Of course not, you can. It just doesn't make you as great of a candidate as somebody with these previous characteristics. Now, thing number five that you need to know is that there is no way back, okay? Once you start balding, especially, chances are you will want to maybe, you know, get a hair transplant and camouflage these areas, maybe your receding hairline. And since you already got a beard transplant with utilizing your occipital, you know, the hair from the occipital region, it's gonna be, you will have limited options in terms of restoring that missing scalp hair later on in your life, because you may want to get a beard transplant right now in your 20s, but in your 30s or 40s, you start, you know, encountering male pattern hair loss, and you will want to, you know, combat that and make your hairline look better. So be aware of that as well. And that's why I'm saying all the guys who have this hair and this hair are better off, because they can use that and spare this hair for the scalp hair restoration, because this hair is the best for scalp hair restoration. This hair and this hair is not so good for the scalp. That's why I much rather, also in my case, I use that for the graft. But if I hadn't this hair, I would have never got beard transplant, okay? I would have never got a beard transplant, because I know that this hair is ideal for the beard, but this is not as much, and I would much rather use my scalp hair for here, okay? So that's just my thought. And also, I would not get a beard transplant before 25 years old, because I see many guys with 25, their beard can look much better with 30 than it was 25. So it's still developing. If you're using minoxidil, if you're using dermarolene, if you're using oral castor oil, these things can help. So I would definitely not consider the beard transplant earlier than 25. Okay, maybe if you've been using minoxidil for at least a year or two in your early 20s, then I would be like, all right, maybe I'm gonna get a smaller one to add more density on some critical areas, but generally I wouldn't consider a beard transplant earlier than 25. I got mine when I was 29. Okay, so that's pretty much all I wanted to say, guys. Let me know how you enjoyed this video. I hope it gave you some interesting insights, which not many people on YouTube talked about as far as beard transplantation. So make sure you give this video a like. For all you new guys, make sure you check out my website and Facebook group. Facebook group is called Hair Transplant Experiences, with over 2,700 members in the group. If you are interested in a hair transplant, visit my website mattdominance.com, where you can also inform yourself about how to get your hair transplant done the proper way. You can also sign up for a one-on-one consultation with me, where I can help you out, assist you in person with your hair transplant research throughout, you know, choosing the right hair transplant doctor or even beard transplant doctor for your possible beard hair restoration. So that was it from me, guys. Thank you so much for watching, and I'm gonna see you soon in another video. Take care.